Good morning students. In this video we are going to study about bruises. Bruises is one of the classification of mechanical injury in the injury chapter. We are going to study about bruises in following these headings: definition, causes, classification, factors influencing and medico-legal importance. When it comes to definition, bruises is the extravasation of the blood in the subcutaneous or subepithelial tissue due to the rupture of blood vessels, usually capillaries, as a result of blunt force injury or the pressure. C. Abrasion, bruises, and the laceration are due to the blunt forces applied. The causes for the bruises are by application of the blunt force such as blow with fist, sticks, iron bar or chain, from compressions like pressing fingers. When it comes to classification, bruises are classified as intradermal bruises, subcutaneous bruises, and deep bruises. In intradermal bruises, it lies immediately in the subepithelial layer. In subcutaneous bruises, it is situated in the subcutaneous tissues like fatty layer. In deep bruises, bleeding deeper to the subcutaneous tissue. So, in intradermal, lies immediately the subepithelial layer. In subcutaneous bruises, it is lies just in the subcutaneous tissues like fatty layer. And deep bruises, it is deeper to the subcutaneous tissue. In intradermal bruises, it is made by the impact with the patterned object and the hemorrhage is sharply defined. In subcutaneous bruises, it appears soon after the injury as a dark red swelling. So, we can see the bruises as a dark red swelling soon after immediate of the injury. And in deep bruises, it is a delayed type because bruise appears hours to 1 to 2 days after the injury. It takes almost hours to 1 to 2 days to develop the bruises. Next, factors influencing the bruises. So, the factors which influences the bruises are type of tissue. See, if the tissue is soft, it can bruise more. The soft, lax, and the vascular tissue such as face, scrotum, eyelid develops larger bruises even with a little force. In strongly supported tissues like abdomen, back, scalp, palm, even moderate violence produces only a small bruises. So, if the tissue is soft, it can bruise more. If tissue is hard, so there is small bruises are there. When it comes to age, children and elderly bruise more easily because of softer tissues and delicate skin in the children. See, if you come to the children have more delicate and soft tissues, so they bruises more. In elderly people, there is a loss of subcutaneous tissue, like subcutaneous supportive tissue. So the elderly people also bruises more. When it comes to sex, women tend to bruise more easily than men because tissues are more delicate and subcutaneous fat is more. Color changes. Bruises is more clearly seen in fair-skinned people than those with a dark skin. Natural diseases. So the person suffering from the genetic disorders like bleeding gases, hemophilia, scurvy, etc., they bruises more, even in the following minor trauma. Gravity shifting of the blood. Here the bruises are appear at the site other than the site of injury like black eye. Blood will track along the path of least resistance. When it comes to medico-legal importance, by the age of the injury can be determined by the color changes. So by the change of the color we can detect the age of the injury, and the degree of injury may be determined from their size. Pattern bruises may connect the victim and the weapon. The pattern bruises seen on the person, so it can relate to the weapon, the type of weapon used in the crime. And the nature of injury. These are simple injuries, but the injury to the vital organs are grievous in nature. Character and manner of injury. Bruises of the arm may be sign of restraining of the person. Small bruises along with the nail marks on the inner aspect of the thigh of women may indicate the sexual assaults. Bruising of the shoulder blade indicates firm pressure on the body against the ground. Bruises found in the softer site in the child such as cheek and trunk suggest the abuse of the child. So thank you.